Hello everyone, welcome back to 4x11. This is third part of the video series on acute pancreatitis imaging. Today we are going to discuss about imaging of complications of acute pancreatitis. Few of the important local complications of the acute pancreatitis are enlisted here. They include infection, vascular complications, pancreaticoenteric fistula, disconnected pancreatic duct syndrome, and biliary obstruction. So let's take a look at all of them one by one. Infection is thought to result from the bacterial translocation from the gut. But how does infection appear on imaging? The only reliable sign of infected collection on imaging is presence of gas within the collection. But it's not found in all cases of infection. Here in this image we can see gas bubbles within the collection marked by the arrow. But it's not just infection that causes gas. Gas can also develop post-intervention such as after insertion of percutaneous drainage catheter. However, in the absence of any intervention, gas within a collection is highly suggestive of infection. But we must also remember that absence of gas does not rule out infection, as only a small percentage of infected collections actually show gas on imaging. We can see infected collections in the above two images showing gas bubbles within them. Now, would you think of infection when you see gas bubbles within a pancreatic collection? Okay, gas is one thing that can tell a collection is infected. Anything else? No, actually, there is no other reliable imaging sign to suggest that a collection is infected apart from the gas. It makes things easy, doesn't it? We must remember that if a fistula develops between bowel and collection, it would lead to development of gas within the collection, and also it would lead to infection, as we know bowel contains millions of bacteria. Here is an image showing a pancreaticoenteric fistula marked by the arrow. It's between the duodenum and necrotic pancreatic collection. This is another image showing development of fistula between colon and pancreatic collection. Also, we can see gas within this collection. Now, coming to the vascular complications, pancreatitis can cause splenic vein thrombosis, pseudoaneurysm formation, and pseudoaneurysm can subsequently cause hemorrhage. Splenic vein thrombosis is relatively common in patients with pancreatitis, occurring in as many as 10 to 40% of cases. Although much less common, portal and superior mesenteric vein thrombosis can also occur as a result of pancreatitis. This is an image showing hypodense filling defects within the splenic vein suggestive of thrombosis. In pancreatitis, the inflammation can involve the abdominal vessels like splenic artery, gastroduodenal artery, pancreaticoduodenal artery, and gastric and hepatic arteries, which in turn causes necrosis of vessel wall and pseudoaneurysm formation. It can cause life-threatening hemorrhage. This is a non-contrast CT showing a collection in the region of splenic hilum. Within the collection, we can see hyperdense contents suggestive of hemorrhage. But why hemorrhage developed? This is arterial phase CT of the same patient. Here we can see a small bright area within the collection. It is pseudoaneurysm of splenic artery, which is showing attenuation similar to aorta. This is maximum intensity projection image showing the origin of pseudoaneurysm from the splenic artery. Here in this image, we can see another pseudoaneurysm that developed in a case of pancreatitis. Okay, look at these two images. What do you see? We can see that intrahepatic biliary radicals are dilated, marked by the yellow circle. But what's the cause? Look how there is bulky heterogeneous pancreatic head causing mass effect and compression of the intrahepatic common bile duct, which is severely narrowed, resulting in upstream dilatation of biliary radicals. So now we know another complication that can occur as a result of acute pancreatitis, that is biliary obstruction. Okay, take a look at this CT now. We see that there is necrosis of pancreatic parenchyma marked by the yellow asterisk. The distal pancreatic parenchyma is now separate from the proximal one with no intervening tissue left. But what about pancreatic duct? How would secretions distal pancreas be drained? Yes, in such cases, the pancreatic secretions cannot be drained, and this leads to persistent leakage of pancreatic fluid. Here is an illustration showing disconnected pancreatic duct syndrome. The necrosis disrupts the continuity of the pancreatic duct, and thus there is impaired drainage and persistent leakage of pancreatic fluid. Here is another CT showing disconnected pancreatic duct marked by the yellow asterisk. The distal pancreatic parenchyma marked by the arrow cannot be drained effectively, now thus causing leakage of secretions. So guys, this was all for today. I hope you liked this video. Thank you and have a good day.